I'm curious about two aspects of your innovative work, Dr. Cosgrove. Could you tell us a little bit about the impact that your Arts and Medicine Institute is having? Also, I'm wondering whether you have thought of establishing a culinary institute to train people in healthy preparation of food and possibly putting out a product with a Cleveland Clinic label on it.
Well, let me start with the arts and medicine. We think that any sort of experience is multidimensional. I don't think that you would go into a hotel or a restaurant or anything and expect that it would be anything other than that. And similarly, we think that the arts and medicine have an important part to play in one's psychological recovery around disease. And so we have put together a whole program across all of our facilities involving art and performance that takes everything from dance to music to art and sculpture, etc. So it has been very successful, and patients find that the environment is significantly more uplifting than it could be without those sort of amenities. As far as food is concerned, actually, we do teach people how to cook. My friend Michael Roizen here is teaching people to cook in a disease reversal program. The idea being that there are a number of steps to living a healthy life that include exercise, stress reduction, eating properly, etc. And part of that course is teaching people how to eat appropriately and cook appropriately, and I might add, shop appropriately, and learn how to read labels, etc., and the food that you're purchasing. So I guess we are into it in a very major way. We have been approached on multiple occasions in the past about food products. It's a question of exactly what business we're in. Currently I find myself in the restaurant business, in the laundry business, in the healthcare business, hotel business. I'm not sure that the food business is something that I have or the institution has any particular expertise in. So for the moment, I think we're going to pass on that opportunity.
Dr. Cosgrove, a little bit of a follow-on question from more of a global perspective. I was curious as to the clinic's logic and strategy going forward to move beyond northeastern Ohio into other regions of the U.S. and then beyond our borders, because you're already in Canada and Abu Dhabi.
Yeah, let me speak specifically about Abu Dhabi because there has been a great deal of publicity about that. And I might give you a very brief history of how we happened to do this. In 9/11, after 9/11, our Middle Eastern population shrank dramatically. We used to do about 35 cardiac operations a month. 2 months afterwards, we were doing 3 to 5. We initially thought about the possibility of meeting them halfway in London. That was a series of searches which turned out to be unproductive, and in the meantime, several countries approached us about the possibility of doing facilities there. Abu Dhabi came to us with a very attractive proposal. Essentially, what we do in Abu Dhabi currently is run a 750-bed hospital, and we are building a 360-bed hospital. In total, we'll have about the same number of beds in Abu Dhabi as we do on our main campus. The question as frequently asked to me is, why are we investing in Abu Dhabi as opposed to Northeast Ohio? And I can tell you with absolute certainty that we are not investing in Abu Dhabi. Not one penny from Northeast Ohio has gone to Abu Dhabi so far. Abu Dhabi is building the buildings, they're paying the salaries, and they're paying us a very handsome consulting and management fee. So I think we can look at this as our petrodollars returning to Cleveland. And a lot of the things we've been able to do in Cleveland we couldn't have done had it not been for our relationships in Abu Dhabi. And I think if we do it well, there'll be multiple opportunities for us to do it other places in the world. Interestingly, there are very few things that the world wants from the United States right now. They don't want our cars particularly, and they don't want our refrigerators. They're interested in our graduate education, our entertainment, our financial services, our innovations, IT, and our health care. And we're the only healthcare organization in the United States that has actually gone and populated and run and built a healthcare facility overseas. And that is a huge undertaking for us.
Dr. Cosgrove, over here, other side.
Oh, there you are.
In order to obtain sufficient support to get the current health care bill passed, the Obama administration put cost containment off the table. If you were in charge and had the opportunity, what 2 or 3 moves would you make to impose cost containment on the medical system?
I think there are a couple of things that I think we need to talk about immediately. First of all, I don't think that there was enough emphasis on prevention. And as I talked about today, unless we reduce the burden of disease in the United States and we allow obesity and smoking to continue unabated, it will continue to see our health care bill go up. Now, the reason that didn't do it is because they were unable to fix a cost savings by doing that. But nonetheless, I think there was some attempt to do that, not nearly enough. So I think that that clearly should have been more front and center. I think also not clear was the fact exactly what healthcare delivery system we want to have in the United States. There was no stated goal in the healthcare discussion. We never, as a country, came to the point that said, this is the model we'd like to see, and this is where we want to go, and these are the steps we need to get there. And rather, I think we began to address problems one at a time. Insurance problems, cost problems, wellness problems, organization problems, et cetera. So I think that the onus is now on the healthcare industry, if you will, to begin to take cost out of the system. It will be difficult to do that, but it is going to involve everyone in the system, whether it's manufacturers, whether it's providers, whether it's insurers. All of us will have to look at more efficient ways to deliver health care. And there is little guidance right now about how to do that. And I might add, there's not great clarity on what the actual implications of the health care reform bill will be. The regulations have yet to be published or even clearly understood, I think. And so we're going to have to be in a wait-and-see mode to see exactly how this new bill influences everything about healthcare. But clearly, 2 things emerge. We have to drive quality, and we have to drive costs down. And the 2 are not mutually exclusive. For example, if you reduce the infections in a hospital, costs go down. There are multiple examples of that, and we've got to figure out innovative new ways to do that.